Today's lecture begins with chronic pancreatitis. Chronic pancreatitis is defined as a persistent inflammation of the pancreas, and it results in permanent fibrosis and other structural damage. That means this is a non-reversible presentation. Chronic pancreatitis etiologies. 80% of these cases result from alcoholism. The remaining 20% are idiopathic in nature. Now, we're going to see similar causes and pancreatic damage as we see in acute pancreatitis. But with this condition, we have the resultant fibrosis and structural damage that develops over time. This condition is the most common cause of fat malabsorption in adults in the United States. And over 25% of patients that have chronic pancreatitis will develop diabetes within 15 years after the clinical onset of this. Symptoms and signs include episodic abdominal pain, steatorrhea, diarrhea. Those are three of our common symptoms. Now with the episodic abdominal pain, it's typically described as being a severe pain presentation. It typically develops within the epigastric region. It can last hours or for several days. Now, about 15% of patients with chronic pancreatitis will not have pain, but they will have the steatorrhea and the diarrhea, so they'll have the malabsorption problems linked instead of the pain. Typically, the pain presentation in these chronic conditions will spontaneously subside after about 6 to 10 years on average, once the pancreas has been destroyed. Steatorrhea is defined as greasy, foul-smelling stools. They're typically filled with fatty material. Now the signs are going to include gray Turner's sign, that flank ecchymosis, and it's common in both acute and chronic pancreatitis. Cullen's sign, which is the presence of umbilical ecchymosis, that's also common in both acute and chronic pancreatitis. And then erythema nodosum, and this is the development of painful, tender red nodules in the skin, typically over the shins, and is due to circulating lipase. Please review the next 3 slides that show illustrations of these 3 signs. The treatment of chronic pancreatitis really depends on the patient's condition. When they relapse into the acute form, then they're going to be treated with fasting, IV fluids, pain meds as needed. When they're able to eat, the patient must stop alcohol consumption, and they probably need to look at consuming a low-fat diet in order to reduce pancreatic enzyme production needs. Now, they may also require supplementation with fat-soluble vitamins, so A, D, E, K, and they may have to look at having enzyme supplementation as well. Favorable responses to treatment for people that are being treated for chronic pancreatitis include weight gain, fewer bowel movements, the elimination of the steatorrhea, and an overall sense of just well-being. They feel better overall. Please note, chronic pancreatitis does increase the risk for the development of pancreatic cancer. Cystic fibrosis. Now this condition has several AKAs. It's known as mucoviscidosis, fibrocystic disease of the pancreas, pancreatic cystic fibrosis. Cystic fibrosis is an inherited disease of the pancreas, specifically the exocrine portion. It affects the GI tract and the respiratory system. Cystic fibrosis is the most common life-shortening genetic disease in the Caucasian population. 3% of the Caucasian population has the recessive trait. The average patient survives to around 31 to 40 years of age. Remember, where this is a recessive trait, in order for it to express in an individual, it has to receive the recessive trait from both mom and dad. Otherwise, the individual is simply a carrier, and the disease does not express. Now, the disease characteristics include that the patient's sweat glands are unable to reabsorb chloride. So, this leads to the secretion of a salty sweat. We see typically with the overall disease progression over time, the pancreas will develop cystic dilations of the ducts, and then they tend to progressively fibrose over, hence the name cystic fibrosis. All patients show an inability to digest fat, protein, and they may develop diabetes with this as well. So let's talk symptoms and signs. An initial sign may be the presence of viscous meconium, the first feces of the infant. This is identified as meconium ileus, and it may actually contribute to perforation of the bowel, in some cases rectal prolapse, or volvulus. And with symptoms and signs of meconium ileus, there will typically be abdominal swelling on the infant as well as vomiting. Now, other abdominal symptoms and signs that are produced by the inability of the pancreas to supply the digestive enzymes to the intestine are going to include the thick mucus that will block the pancreatic duct, and then the subsequent fibrosing through scar tissue. So this produces pancreatic insufficiency. So as this develops over time, we have no enzymes getting into the GI tract. So large amounts of undigested food are going to pass into the large intestine, producing symptoms like gas, abdominal swelling, steatorrhea. The patient will complain about constant hunger, and they are typically underweight. And there can be an increased risk of diabetes symptoms and signs. Now, interestingly enough, less than 10% of cystic fibrosis patients do not have GI symptoms and signs. So it's a very common presentation with this condition. Diagnosis of cystic fibrosis is identified through either sweat test or by genetic testing. So a sweat test is performed by placing an odorless chemical on the skin to initiate sweating, and then a sweat collecting device is placed over that area on the skin. The sweat's collected, it's analyzed for sodium chloride. Elevated sodium chloride levels are indicating a positive test. A diagnosis of cystic fibrosis is made on a minimum of 2 or more positive test findings.